December 1st is World AIDS Day. The first World AIDS Day was 1988, so this is World AIDS Day number 35. And the theme this year is Remember and Commit. I remember 1981, when those first cases were reported. That was June 5th, 1981, before there was a World AIDS Day. And Dr. Mike Gottlieb, who had been my medical student, reported those cases, and I've talked about him. But that was an era then of mobilizing people through AIDS fundraisers, and here are some examples here. In 1983, the situation was dire enough here that AIDS Rochester was formed. You've heard the story of Sue Cowell, my colleague, who brought a group of people together on her front porch in Rochester and formed AIDS Rochester. She was also instrumental in the formation later on of MOCA and the local AIDS task force. 1985, the HIV test became available, now 4 years into the epidemic. 1987, AZT, the first drug for treatment of HIV, so we're starting to make some headway here. 1989, Community Health Network opened. That was one of the first community-based HIV clinics, because up to then, pretty much all HIV and AIDS care is done in hospital programs. On the opening day of Community Health Network in 1989, Congresswoman Louise Slaughter called CHN a refuge for patients, their families, and for the community, and talked about the good things that will happen here and, quote, maybe someday a cure, unquote. Well, Steve Scheibel, as I've said before, was the brains, scientific brains behind all of that, and many of his theories about HIV care were right on target, and he was way ahead of his time. Around the time of CHN, now Trillium Health's opening in 1989, 1990, I met a surrealist painter named Bill Copley, whose wife was a resident in medicine at St. Mary's Hospital. And he was a big supporter of what we were doing. And what he also did was he painted a picture called Breakthrough. And when he presented it to me, he said, "This painting is meant to express the spirit of hope and faith that the day of the AIDS breakthrough is surely coming." That was in 1990. And then the breakthroughs did start coming. Here we are. Combinations of drugs that suppress HIV so that patients live healthier and longer. The AIDS cocktail, we called them. The idea of starting people on treatment, HIV treatment, as soon as we knew they were HIV positive and not delaying that treatment. The idea of treatment as prevention, where if you have this, what we call undetectable viral load on treatment, you don't transmit HIV to other people sexually. A huge breakthrough. Prevention options, once a day pills or injections every other month. Started a year or two ago. We now have programs for people with HIV who are aging, who are age 50 and older, because those people who have lived longer as a result of those early breakthroughs are now in their 50s, 60s, and 70s and need a different kind of service and program to meet their healthcare needs. And now we're talking about ending the HIV epidemic, which I think in itself is a pretty remarkable public health and medical achievement. So we are making progress then. The commitment piece that they're talking about for World AIDS Day this year is exactly that. We are committing to a world without AIDS.